Hi, I'm Deb Kimmett, and this is part 2 of the news brief for February 21st, 2022. In part 1, we discussed a framework for moving forward in the pandemic. This part 2, will cover long COVID exclusively. Quite a few articles about it came out over the last month, so I'm covering it here in this news brief. However, this topic is so important and affects so many of our COVID clients that I'll update the information periodically as we learn more. Before we begin, though, it's important to remember that science changes, so what we know today may not be what we know tomorrow. This means that the information presented here will evolve and change as we learn more. Before I get into the details, I want to point out a few of the main articles I used. References and links are in your notes. The Keller article has amazing graphics and provides a really great overview of what researchers are finding out about long COVID. The other thing that's really noticeable is at the end of the article is a long list of resources. So if you have a long hauler in your practice, refer them to the article for more information. The Tanner and Unger article also provides good information. So now let's start with some of the basics around long COVID. Long COVID has a specific medical name: post-acute sequelae of SARS-CoV-2 infection, or PASC. This is important because it sets up PASC as a medical diagnosis that can be studied and treatments developed for it. It's estimated that up to a third of COVID patients can develop PASC, and PASC strikes both those who were hospitalized with COVID and those who weren't, which means that you don't have to have a severe COVID case to develop PASC. The general concern is the potential impact of long COVID on the economy and on the healthcare system. One expert even thinks that it could be more impactful on the economy than acute COVID. What causes PASC? No one really knows, and it's thought to have many potential causes, some of which include the virus embeds itself in the tissues so that the, quote, infections or remnants of the virus persist past the initial illness, triggering inflammation that leads to long COVID, unquote. Another potential cause is dormant viruses that are already in the body get triggered. For example, the Epstein-Barr virus, which causes mononucleosis. Another one is autoimmune reactions that cause autoantibodies to attack the body, similar to lupus or muscular sclerosis. And these can attack the body several months after the initial infection. Another cause is microclots. That combined with elevated proteins in the blood plasma that prevent the normal breakdown of the microclots, because that will, quote, reduce oxygen distribution in cells and tissue throughout the body, leading to most, if not all, symptoms that have been linked to long COVID, unquote. And yet another cause is inflammation from cytokines that, quote, may injure the mitochondria that power the body's cells, making them less able to use oxygen. Walls of blood vessels may also become inflamed, limiting the uptake of oxygen, unquote. The upshot of all these possible causes is that it's going to mean that treatments are going to be different for each person because each cause requires a different kind of treatment. Doctors are also starting to figure out what are the risk factors that may increase a person's chances of PASC. This information is based on a small peer-reviewed study of about 200 people. The article says that more study needs to be done, but other articles are talking about some of these risk factors. The risk factors that might raise your chances of developing long COVID are viral load early in the infection. This is checked by measuring the amount of the virus RNA in the blood. The higher the viral load, the more at risk you are. Another potential risk factor is the presence of autoantibodies. These are antibodies that attack the body rather than foreign substances. This occurs in conditions like lupus or in rheumatoid arthritis. So if a person has these diseases, they're also at risk. And a third potential risk factor is previous Epstein-Barr virus infection. That's the virus that causes mono. So if a person has had mono, the Epstein-Barr virus is dormant in the tissues and can be reactivated. If it's reactivated, that's a risk factor. And the fourth risk factor is type 2 diabetes. The massage therapist's takeaway of all this is that, first of all, a significant number of your clients may have or develop PASC. They can develop long COVID long after they were initially infected. And there appears to be many causes for PASC, each with its own treatment protocols. Understanding the risk factors for developing PASC can help you help your clients take better precautions and to get to a physician for better diagnoses and treatment. For example, anyone with an autoimmune disease or diabetes or has had Epstein-Barr virus or mono when they were younger are all at risk. If a person has had these, it's important to impress upon the client that it's important to tell their doctor when they don't seem to be getting better. Again, it'll help that doctor make a better treatment plan for the individual. And finally, use the Keller article to steer your long COVID clients to doctors and other resources. Here's some other information of note. In the United Kingdom, the UK Health Security Agency looked at several studies to answer two questions that I've had for a while. The first is whether prior vaccination is effective against getting long COVID. We know that the vaccines do a good job of protecting us from getting COVID, but that doesn't mean that we can't get it. And also, we know that the vaccines, if we're boosted too, can do a good job of protecting us from severe COVID. But what about long COVID? This information helps us understand that a little bit. The other question I had is what happens when an unvaccinated person develops long COVID and then gets vaccinated? Does it help mitigate the symptoms? And the UK article looks at that one too. So here's what they found out. Let's look at the first question. If you have been vaccinated before contracting COVID, you are less likely to develop long COVID up to 6 months after infection. And for those who did happen to develop long COVID, they were less likely to develop some of the major symptoms that are found in unvaccinated people. The upshot is, if you can get the jab, please do. And as far as whether getting the jab after developing long COVID helps, there's no clear data. Most people didn't seem to have any change in their symptoms. But for those who did have changes, usually more people got better than those who got worse. But in one study, more people got worse than got better. The massage therapist takeaway: vaccination will help you avoid long COVID and the major symptoms if you do develop long COVID. The jury's still out on whether getting vaccinated after developing long COVID will help. For most, it won't help. And for the rest, it might make you feel better or it might make you feel worse, but usually better. So basically, you're taking your chances on that. We just need more data to really know. And finally, an article on long COVID and exercise can have a bearing on our practices as well. Researchers found that as many as 89% of long COVID patients feel worse after exercise, and it's not because they're out of shape. A small study, quote, found that some veins and arteries were not working properly, unquote. The upshot of the article is that the experts have conflicting opinions as to what to do. Some say PASC patients should not exercise, but the main doctor in this story said that after you've been treated for COVID, it's possible to begin the process, but very slowly. And it's important to take an individualized approach as every patient is different. They may have different causes for their PASC. So what works for one patient may not work for another. And as I said, we can apply some of these ideas from this article to show how we generally should treat those with PASC too. So the massage therapist takeaway: individualize your treatment. Every client will be different due to the reasons why they have long COVID. Start slowly to determine resilience and to not overwhelm their system. And follow the guidance from Ruth Warner, because she's done a lot of research on this and has very good ideas in terms of how to work with clients who have either COVID or long COVID. And there's lots of information on screening questions, treatment considerations, and other information in our materials. And I've put the links in your notes as well. And so that's all I have on PASC right now. As I mentioned earlier, we'll try to keep this video updated as we go along and as new information develops. So that's it for today. Thanks for watching. And again, please remember that science changes. So what we know today may not be what we know tomorrow. Stay safe and be healthy.